Hi, my name is Elizabeth Halsell, and I'm currently enrolled in the Rural Family Nurse Practitioner program at Eastern Kentucky University. During this presentation, I will be presenting my evidence-based project proposal for NSC 892. I will be discussing the significance and impact of implementing immunization reminders into the primary care setting to increase immunization rates in the pediatric population. Anti-vaccination continues to be a problem worldwide and increases the incidence of preventable diseases every year. Scheduled immunizations are crucial for people of all ages. However, the pediatric population is at increased risk for lack of immunizations. Children ages 2 and younger are at increased risk for infectious diseases, including sepsis, pneumonia, and meningitis. Scheduled immunizations can protect children from 14 vaccine-preventable diseases and saves over 33,000 lives every year. Healthy People 2020 distinguishes one of their goals as increasing immunization rates and reduce preventable diseases. The purpose of this project is to evaluate research, develop an intervention to be integrated into practice, and to discuss my proposed method of intervention to increase immunization rates in the pediatric population, ultimately preventing infectious diseases and decreasing unnecessary deaths. Numerous healthcare provider-based interventions have been implemented to overcome vaccine noncompliance. Research has shown a positive correlation between patient reminder and recall interventions and increased immunization rates. Throughout this project, I've evaluated and analyzed 4 different research studies supporting the use of the patient reminder and recall interventions. As a family nurse practitioner, implementing these interventions is crucial to promoting health and wellness in patients. Research included in this evidence-based project proposal includes studies ranging from meta-analysis to qualitative review, as well as randomized control trials. The first study I reviewed was a meta-analysis that included 75 studies. The study findings in this meta-analysis did prove that patient reminder and recall interventions had a significant impact on immunization rates. The second study I reviewed was a randomized control trial. The goal of this study was to determine if the use of a simple intervention package, including patient reminder interventions, could have a significant increase in influenza vaccination rates. The study findings prove that the intervention package improved influenza vaccination rates 22% in children 1 year of age and 25% in children 2 years of age. The third study included in this evidence-based project proposal was a qualitative research study to evaluate parental readiness and acceptance of text message immunization reminders. The research found that the participants were accepting and interested in receiving these text message reminders for their child. The final study included was a level 2 study evaluating the effectiveness of text message reminders increasing HPV vaccination rates. The study findings proved a statistically significant increase in HPV vaccination rates when utilizing text message reminders. Research included in this evidence-based project proposal all proved value for nursing practice. The goal of nursing is to provide holistic, comprehensive, and healing care while promoting health and wellness in all patients. Unnecessary and preventable diseases and deaths occur each year from a lack of vaccinations. By implementing interventions into daily practice to increase immunization rates can reduce preventable diseases and improve the overall health of patients worldwide. Based on research conducted throughout this project, my evidence-based practice project proposal is to implement patient reminder and recall interventions into practice to increase immunization rates in the pediatric population over a 1-year time period. One of the roles of the family nurse practitioner is screening patients for immunization records and ensuring patients are up to date with their vaccinations. The American Academy of Pediatrics Ohio Chapter 2018 created an immunization screening tool that can and should be utilized by healthcare providers. By utilizing this screening tool, the FNP can easily identify which patients are not up to date with their immunizations and implement patient reminder and recall interventions to increase immunization rates among patients. Implementation of patient reminder and recall interventions are practical, cost-effective, and relatively simple to implement into the primary care setting. Step 1 of the proposed plan is to create stakeholders, such as the nurse, including nurse practitioners, physicians, receptionists and secretaries, and parents and guardians of patients seen in the practice. After implementing the screening tool with patients and identifying which immunizations are due or overdue, the advanced nurse practitioner can implement patient reminder and recall interventions into practice over the 1-year time period. Month 1 would consist of recruiting stakeholders, identifying immunization needs of patients, and calculating the immunization rates of the patients seen in the practice. The baseline immunization rate would represent the standard care previously provided for all patients. During the next 3 months, each month is dedicated to implementing each of the reminder interventions. The following 2 months are used to evaluate which intervention was most effective at increasing immunization rates. During months 7, 8, and 9, the most effective reminder intervention will be utilized for optimal increase in immunization rates. The last 2 months of the one-year project will be used for evaluating and disseminating findings. In order to evaluate the effectiveness of the proposed intervention, the baseline immunization rate among current patients would need to be calculated prior to the implementation of the reminders. Effectiveness of the proposed intervention will be determined by receipt of immunizations and comparing baseline immunization rates with post-intervention immunization rates among patients seen in the practice. A more detailed timeline of my project proposal has been included in my poster. In conclusion, anti-vaccination continues to be a problem worldwide and leads to preventable illnesses and deaths every year. Improving vaccination rates is critical in health promotion for all patients, specifically in the pediatric population. Implementing this evidence-based project proposal into practice will increase immunization rates and decrease communicable disease rates among the pediatric population. Thank you for your time, interest, and consideration in this project. Have a good day.